Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm very pleased today to be interviewing Dr. Barry Kerzin, who is a visiting professor with the University of Washington and an honorary professor at the University of Hong Kong. Dr. Kerzin, thanks so much for joining with me this morning.
Thank you for having me, Larry.
So could you give us an idea about your background? Where are you from? What brought you to medical school? And what brought you to family medicine?
I was born in Hollywood at Good Samaritan Hospital on All Saints Day. I was raised in Southern California. I went to school at UC Berkeley, received a bachelor's degree in philosophy, and then went to University of Southern California for my medical training. As a child, age 11, I had a subdural abscess, was in coma, nearly died, and as a result of that experience, deep in my heart, I wanted to be a doctor. Nobody in my family had been a doctor before. Thank you very much for hosting. And so I then pursued medical education, and after my medical degree, went to Ventura County Medical Center to receive my residency training and board certification in family medicine.
And describe your career path following residency training.
After I finished my my residency, with another fellow resident, we set up a practice of family medicine in Ojai, California, which is up in the mountains from Santa Barbara, and a small town, and we worked there. I worked there for about 7 years. We did obstetrics. I was on call every other night, and it was a wonderful experience, except that when I first started my practice, after I finished my residency and went into private practice, my wife came down with ovarian cancer, and 3.5 years later, she died. So that was a very traumatic period in my life. And as a result of that, several years later, after she died, I moved up to the University of Washington and took a faculty position as an assistant professor in the residency program in the medical school in the family practice residency program.
And what kind of activities were you engaged in while you were there at the University of Washington?
I was doing mostly teaching, some research, and of course some administrative responsibilities.
And how did you connect with His Holiness the Dalai Lama?
Well, while I was up at the University of Washington, a friend of mine came back from a meeting in Dharamsala. It happened to be the first Mind and Life Institute meeting or conference with the Dalai Lama and top-notch international scientists. That was in the the mid-80s, 1980s. And at that meeting, His Holiness the Dalai Lama said he would like a Western-trained physician to come to Dharamsala to interdigitate different medical systems, not to make them one, but to have them available for anyone who is sick. If allopathic medicine wasn't working, then turn to another healthcare system, etc. I was very excited by that prospect, and I took my 2 months vacation that I had saved up, went to Dharamsala, and interviewed people and looked at the situation and thought that it was a go and thought I would go for 6 months. So about a year later, I left for Dharamsala for 6 months. And what we were doing, I was teaching some research methodology using we did actually a study looking at the efficacy of Tibetan medicine in treating high blood pressure. And I did that with a number of the Tibetan medicine doctors who their institute was interested in doing some study of their medicine. So this is what I did the first 6 months. I extended that to about 7-8 months. In the meantime, I had hired someone to cover me in my practice in Ojai. I'm sorry, I had gotten a lot of my responsibilities covered from University of Washington. After the 6 months, I extended to a year. We finished our project, and then I got really interested in meditation and study of Buddhist philosophy and psychology. So I kind of shifted, and I then extended again my visa, and not knowing that that would turn into 27, almost 28 years.
So that's a really fascinating path. And along the way, you decided to create something called the Altruism in Medicine Institute. Can you tell us about that?
Certainly. This Altruism in Medicine Institute is a passion for me, and now a number of other people that we're working together. It started, I think, when I moved to Dharamsala. I continued to practice medicine on a part-time basis and always on a charitable basis. I never charged anybody anything. And in fact, people that were poor, sometimes I will buy their medications for them. And I think those were the seeds. And it was very important to me in the practice of medicine, both at the University of Washington with the family practice residents, and also when I moved to Dharamsala, is to honor the patient, to respect the patient, to try to develop as best I could a trusting relationship with the patient, because I feel deeply, and now there's a lot of research that corroborates that a trusting relationship, doctor-patient relationship, yields better outcomes, certainly in terms of satisfaction, but it looks like sometimes in terms of healing, better outcomes in terms of morbidity, and there's even some studies showing some better outcomes in mortality, particularly some studies with breast cancer patients. So I think those were the seeds. And then about 2.5 years ago, we established this nonprofit organization with a 501c3 for tax deduction donations in USA. It's now housed in Phoenix. We have a board of about 4 people. We have volunteers of about a dozen, and we work internationally. We teach medical students, nursing, dental, and other healthcare students about compassion, and particularly we teach them how to reduce the blocks to compassion, which are harmful or destructive emotions like anger, jealousy, pride, greed, selfishness. So this is one of our major activities, is teaching healthcare students. I teach a lot in hospitals to doctors, nurses, etc., all over the world. Just a few months ago, we had an intensive 6-day course for doctors at the largest private hospital in Japan, in Tokyo. So these are some of the activities that we do, and it's all based, our purpose is to enhance compassion in healthcare.
That's wonderful. Can you, what are your aspirations? What would you like to see happen through the Altruism in Medicine Institute?
You know, Larry, there's a tremendous amount of interest around the world in medical schools, in hospitals, in doctors' organizations, also among health administrators and executives, because they see that, you know, there's a lack of good dialogue, good, healthy, meaningful dialogue in their communities with doctors, with other healthcare executives and administrators. And so we really want to foster better dialogue, and dialogue is based on respect, mutual respect. And so we're trying to help foster that around the world in healthcare environments. We've already done quite a good job in certain niches, certain pockets. And so we're trying to scale that up, work more and more with medical schools, more and more with hospitals, try to get some of this curriculum ingrained in part of the educational system for doctors and other healthcare professionals. And that's what we see in the near to midterm, looking ahead maybe 3-5 years. Looking ahead maybe 10 years or longer, we want to scale up and have more groups linked to us doing the same work in different communities throughout America and in different parts of the world.
That's great. Could you speak to the issue of family practice, particularly with residents and medical students? Should we be teaching residents and medical students to meditate? What are your thoughts about that and how we might do that?
Yeah, I think what's really essential is compassion or altruism. This is not based in any religion. It's based on a humanism, which brings more meaning to the life of the patient if the doctor practices compassion. But as importantly, it brings more meaning to the life of the doctor. And doctors are struggling these days. So many of my friends are just, they're just trying to tread water, not to go under. And a lot of this is because they've lost sight of what's really meaningful in their life, particularly in their medical careers. So I think it's a tremendous potential for meaningful life, but we have to kind of break through some of these barriers, and compassion is the real key. I don't think meditation should be required for all doctors, no, but I do think it should be available for those that are interested. And now we're seeing more and more young people getting interested in meditation because they realize that it's something that can help their health on many levels, not only their physical health, their emotional health, but also their spiritual health.
So I'm wondering, you've had just a fascinating career and life path from California to Washington to really a global leadership role, and especially in your capacity as the Dalai Lama's personal physician, you've come to see and be connected with a world that's really quite amazing. So as a family physician, it's really a remarkable career path. And I'm wondering if you might have any advice for those who are considering a career in medicine and family medicine going forward.
I think family medicine for me has been a tremendous joy, tremendous opportunity. When I went through my residency or my internship and my medical school training the last 2 years, I kind of enjoyed all the rotations. I enjoyed surgery. I enjoyed orthopedics. I enjoyed pediatrics. I enjoyed obstetrics. I enjoyed the counseling aspect of psychiatry. So that's what led me into family practice, because I wanted to do it all. And I'm so happy that I made that choice. It's a carte blanche internationally for those young people that are interested in doing some work internationally. You can basically write your own ticket with a medical degree and a residency, a board certification in family medicine. One example is right here talking to you, who's now the physician for His Holiness the Dalai Lama. So there are incredible possibilities and opportunities that you don't see right now when you're in your residency program. And even when you get out, you don't see it in America so much. You have to sort of go abroad, and then all of a sudden all these doors open. Tremendous possibilities of using your medicine in many different creative ways.
Dr. Kerzin, thank you so much for sharing your path and your perspective. We will be sharing this broadly with even down to high school students, so they might hear about your experience and about the sense of compassion and hope that you convey. So I appreciate you talking with us today.
Thank you very much, Larry. Dr. Bauer. Those people that would like to communicate with me can do it on Facebook. I have a public figure site. It's just my name, Barry Kerzin, BARRYKERZIN. Thank you very much, Dr. Bauer.
Oh, you're welcome.